Welcome to Chillin' 101. We hope this video helps.
You start by preparing the area. Wash and dry the target skin thoroughly so the cream can absorb properly. Once done, perform a patch test on your inner wrist and wait 24 hours to check for irritation. This avoids surprises. Make sure you are not using strong exfoliants or retinoids that day because mixing can increase sensitivity. Apply only to intact skin. If there's any open wound, delay until healed. These steps set the foundation for safe, effective treatment. Now you apply the cream with control. Dispense a pea-sized amount and dot it onto each white spot, then blend outward with light, circular strokes so the product forms a thin, even layer. Make sure to avoid eyelids and mucous membranes and do not overapply. More product won't speed results and may cause irritation. If you use other topical meds, wait 10-15 minutes between applications to prevent interactions. Keep a consistent 1-2 times daily schedule for best absorption. To finish the routine, let the cream absorb fully, then apply sunscreen with at least SPF 30 during daytime because treated skin is more light sensitive. Monitor the treatment area for 2 weeks. Mild redness or flaking can be normal, but if you see persistent swelling, intense itching, or spreading discoloration, reduce application frequency or stop and reassess. One key troubleshooting tip: if severe irritation occurs, discontinue immediately and consult a clinician. This avoids complications and ensures you get appropriate care.
Thanks for watching. Consider subscribing if we helped you.